Okay. While folks start to trickle in, I will go ahead and get us started. My name is Callie Simon. I'm an Adolescent and Youth Health Advisor on Momentum Country and Global Leadership. Thank you for joining this consultation to inform the global learning agenda on adolescent contraception access and choice. We're working on this in collaboration with many wonderful colleagues, including colleagues from the World Health Organization Human Reproduction Program and the Carolina Population Center at the University of North Carolina at Chapel Hill. We have interpretation in French today, so I will pass to my colleague Angela for instructions on accessing this feature.
Bonjour tout le monde, bienvenue. Pour l'interprétation en français, cliquez le globe en bas de l'écran pour l'interprétation simultanée en français. Si vous pouvez couper le son d'origine en cliquant sur Mute Original Audio. Merci.
Thank you, Angela. And I'm just going to leave it on this slide for one moment in case folks are needing to access the interpretation and making sure everyone who needs interpretation is on the right channel and listening as best they can and hearing as best they can. Okay, great. Okay, next slide. So we're going to begin our session today with some welcome remarks and opening remarks from Corey Warnell, who is a Youth and Reproductive Health Advisor with USAID. USAID is supporting the development of this global learning agenda, building on past investments from the Bill and Melinda Gates Foundation and USAID in an original learning agenda in 2018. We're really excited to have Corey here, and I'll pass over to you now, Corey.
Great. Thank you, Callie. Greetings, everyone. I am so excited you are here, and I am excited to be here with you. I want to welcome you to this virtual consultation to inform the updates to the Global Learning Agenda on adolescent contraception access and choice. Thank you for being here and for lending your voice to this process. Since you're on this call, you likely know how important it is for adolescents to have the choice of if and when to use contraception, and to also have access to high quality, respectful contraceptive and reproductive health services. There have been some important advances in what we know about how to meet the contraceptive needs and rights of adolescents over the last 30 years. Much of that important evidence and learning has been generated by people who are here with us on the call today. However, there is still more we need to know about how to best meet the contraceptive needs and preferences of diverse adolescents. One piece of doing this work well is ensuring we are listening to young people about what they want through engagement during all parts of this learning agenda, which is why you are here with us today. And with limited resources for adolescent sexual and reproductive health, it is imperative that we are working together to align our collective efforts on the most important and catalytic questions that, if answered, will impact how we design, implement, and scale approaches that meaningfully improve adolescents' ability to choose if and when to use a contraceptive method and access the health services they need. That is where the updated Global Learning Agenda on adolescent contraception access and choice comes in. USAID participated in the development of a similar learning agenda in 2018. That agenda was led and funded by the Bill and Melinda Gates Foundation through the Full Access, Full Choice project. After 8 years of progress, I'm excited to be a part of this participatory process to update the agenda in order to ensure the revised version reflects the real gaps in evidence that are the highest priority to meet adolescents' needs at scale. Through the agency's youth and development policy, USAID established its championship of meaningful adolescent and youth engagement and the importance of young people participating in the processes that impact their lives. I and other youth advisors at USAID applaud the efforts of Momentum Country and Global Leadership, the World Health Organization, and the Carolina Population Center for ensuring young people's participation in this process of creating the learning agenda that will take us into the next decade of our important work. As you'll hear from my colleagues shortly, this virtual consultation is one step in a participatory process to develop the agenda. The primary purpose of today's consultation is to hear from you. We want to know if you agree with the questions prioritized so far, or if you would propose any changes as we move to finalize the list. Once we have a finalized list, I hope you, your organizations, and your funders will join USAID and its partners on advancing research and learning on these important questions. When we work together and point our collective resources and efforts in the same direction, we are more likely to generate the evidence we need to best support adolescents. I thank everyone here today for your presence and participation, not only on the learning agenda, but in the great work you're doing for and with young people around the world. Callie, back to you.
Thank you so much, Corey. Really appreciate you as welcoming remarks. And actually, it sets us great for the conversation today. I'm going to go on to the next slide. As Corey said, we are updating the global learning agenda, and the purpose is to galvanize all of us and our colleagues around a set of prioritized questions that will most effectively advance our field. Next slide. The learning agenda focuses on adolescence. It's global in nature, and it aims to ultimately improve a range of different outcomes related to adolescent contraceptive choice, access, and use. Next slide. And as Corey said, this is a moment in a much longer process. And I want to briefly summarize that process for you today so you know where we've come from and where we are going. We began this process by compiling questions that remained unanswered from two different global initiatives. The first was a WHO process to update the global guidelines related to adolescent pregnancy prevention and contraceptive use. And through that process, a massive literature review was done that informed a set of questions that were, in fact, well answered by the literature, but also allowed us to identify questions that, in fact, had not yet been answered by the literature and by research and evidence. So we took those unanswered questions and we combine them with unanswered questions from that original 2018 learning agenda that we've mentioned, where we had full access, full choice as a project, conducted a review to identify responses or literature that responded to those questions, and ones that felt unanswered with insufficient literature were added to our list of unanswered questions. Then we sent a survey out in multiple different languages to all of you and the broader community. We had over 100 different individuals respond from 40 different countries. And it was an open ended survey inviting any question that people thought would be important to answer as it relates to adolescent contraception access and choice. We then consolidated that very, very, very long list. And I want to give credit to my colleague, Caitlin Cornelius, who helped us with this work extensively, did a lot of work to consolidate that question. And then we had an advisory group. Some of our advisory group members are on the call today, some are not. It's about 25 different people, including young people, researchers, funders, implementers, local organizations from a range of different countries who helped us by scoring that longer list of questions based on 5 criteria. The criteria included, did this question respond to a gap in evidence? Did this question, if answered, would it impact the outcomes that we care most about as it relates to adolescent health and well-being? Is the question generalizable in the sense that it might be applicable to multiple different countries, contexts, and adolescent subpopulations? Would the question be feasibly answered? And could the question be ethically answered? Based on that scoring, we came up with a preliminary list of prioritized questions, and we met with our advisory group to discuss those questions and hear their feedback. And in that conversation, there was some discussion about certain questions becoming maybe merged or refined, wording changes, and some questions that maybe hadn't been prioritized in the quantitative scoring, but we felt qualitatively were critical to include. And that brings us to where we are today, here with you all. We will be presenting to you today a set of prioritized questions for your feedback. And we will be breaking into groups in a little bit where we'll be able to hear that feedback. The feedback that you can share with us will include suggestions on questions that aren't prioritized but you feel are critical, questions that are prioritized that maybe you think aren't so critical, and also if there are wording changes or other considerations that we should keep in mind. And once we get your feedback, we will move into a finalization process where we refine the questions that are prioritized and put them together and share them widely for all of us to hopefully concentrate our research and evidence generation efforts to best advance the field together. Next slide. This slide is just the same timeline for our Francophone colleagues. I'll just pause briefly. We do have simultaneous interpretation. The instructions to access that are in the chat, but we also wanted to be sure folks could see visually what we were talking about. Okay, next slide. So as I've said, today we're going to hear your feedback on the prioritized questions. Next slide. And with that, I'm going to pass to my colleague, Sherry. Sherry Bastian is a scientist at the WHO and is supporting this effort and in part of her broader work on adolescent sexual and reproductive health. Sherry's going to give an overview of the questions that were prioritized. We are going to go relatively quickly through these questions to give you a sense of what we're talking about. But as I said, in your small groups, in just a bit, you'll have more time to spend with these questions to really think about them and dive a bit deeper. And with that, I'll pass over to you, Sherry.
Thank you so much, Callie, and warm greetings, everyone. Thanks from my side for joining us today as we delve into the draft priority questions. A quick note before we do dive in. The questions you'll see on the upcoming slides have been slightly truncated just to make them more readable. For the full wording of each question, you'll get that on the mural boards when we go into the breakout groups. And in those sessions, as Callie mentioned, we'll be looking for your insights and feedback to help us refine the priority questions even further. So let's start by exploring the 5 categories we've organized our questions into, each targeting a distinct area of learning critical for advancing the field of adolescent contraception. Next slide, please. So the first category focuses on formative research questions, where we're trying to understand the foundational drivers, barriers, and perceptions that shape adolescents' choices around contraception. I won't read each of the questions in any of the category verbatim, but just share a high-level overview of the main themes. And as you can see, the French version of these questions is available on the right of the slide. So key themes in this category include examining what drives or inhibits adolescents' choice to use contraception, particularly among subgroups most impacted by inequality and discrimination. Understanding how adolescents interact with social media and digital platforms, including those powered by generative AI related to contraception. Exploring adolescent perceptions of contraception's impact on their well-being and future aspirations, and how these perceptions differ. Next slide, please. Our second category addresses implementation science questions, specifically what makes the program's effect, as well as what it takes to scale up and sustain the programs. In this category, our questions focus on identifying the factors that support social and gender norm shifting interventions around contraception to be scaled and sustained, looking at issues such as duration and dose of interventions at different levels. There are also questions which focus on examining practical considerations around digital health interventions, including equity, operational, financial, and confidentiality issues. Next, understanding the cost, barriers, and facilitators to adolescent responsive health systems and the role of different types of financing models in ensuring equitable and sustainable services. And fourthly is a question around strategies to promote meaningful adolescent engagement in all phases, including designing, implementing, and monitoring contraception programs, with particular attention to adolescents facing inequality and discrimination. In a nutshell, these questions aim to provide actionable insights for scaling and sustaining effective programs that support adolescent contraception. Next slide, please. I'll just pause for a moment here. As you see, these are the same questions that were displayed on the previous slide in French. Next slide, please. So our third category focuses on understanding impact and effectiveness, how well different approaches and interventions meet adolescent contraceptive needs. Just to reiterate, the full and final questions will of course have the outcomes of interest spelled out. So this section includes questions around assessing the impact of different service delivery models, as well as the costs and cost effectiveness of each model, exploring whether reducing the cost of contraceptives improves access and equity, especially across different contexts and subpopulations, investigating the effectiveness of digital interventions, including whether they work alone or in combination with other approaches, and how it varies by subgroup, comparing multi-sectoral approaches that combine health interventions with sectors such as education, livelihoods, or civic engagement to see if they produce better outcomes than single sector approaches. Also understanding which social and behavior change components are most effective in influencing contraceptive behaviors and how this varies by context and subpopulation. Lastly, it is important to also look at evaluating a range of outcomes of empowerment-focused interventions for girls. So these impact and effectiveness questions are essentially designed to measure what works best and under what conditions, helping us understand the impact of different strategies. Next slide, please. So as you will see, these are the same questions as the previous slide provided in French. Next slide, please. This category of questions focuses on how new contraceptive methods can be designed, developed, and rolled out in ways that ensure feasibility, acceptability, and equitable access for adolescents, particularly those from marginalized backgrounds. Just flagging that you can see the French version of the questions on the right of the slide. And here in particular, we're exploring questions such as how to ensure that new methods meet the diverse needs of adolescents. Additionally, exploring the potential of multi-purpose prevention technologies and how to optimize them for adolescent use. In summary, these questions aim to guide the development and testing of contraceptive methods that align with adolescents' needs and preferences. Next slide, please. Our fifth category, with again the French version of the questions available on the right of the slide, examines measurement-related questions. For example, we're looking at whether measures used to assess the quality of contraceptive counseling need to be different for adolescents versus adults, identifying appropriate person-centered measures to assess adolescent needs, desires, and preferences, and how to effectively measure social norm changes in contraceptive needs and discontinuation among adolescents as they move through different life stages, among other factors. The measurement questions are essential for capturing a nuanced understanding of adolescent contraception, allowing us to better assess outcomes and make programmatic improvements. So to summarize, the prioritized questions fall into 5 main areas: formative research, implementation science, impact and effectiveness, new contraceptive method research and development, and measurement. As we move into the group work session, you'll have a chance to dive deeper into these questions. We're very much looking forward to hearing your thoughts on these draft prioritized questions to help us refine them. And I'll hand it back to Callie now, who will provide a bit more information about the breakout groups and next steps.
Thank you so much, Sherry. What a wonderful job summarizing the bigger picture of where we are, these different categories of questions that we've developed through the process that we articulated earlier, thanks to input from many of you on the call to date. We are now going to use the bulk of our time together to hear from you. And to do that, we're going to break into small groups. Next slide, please. In just a moment, we will open the groups. There will be 2 groups for French speakers, for Francophone colleagues, where you will be discussing in French, and there will be 2 groups for colleagues who prefer to discuss in English. We will give you the choice to join one of those groups based on your language preference in just a moment. During the groups, we will share a mural board. If you don't have access to the mural board, it's okay. You can still contribute verbally and in writing in the chat box. And we're going to ask you to first start with one category of question to make sure that each group starts with a different category at the beginning. Review those questions. If you agree with the questions, we're going to ask you to put a little star on the sticky. If you think that question is a priority and is something that our community should be working together to answer. If you would like to suggest a wording change to the question, you may use yellow sticky notes to write your wording changes. And if you'd like to suggest a different question that you think really should have been prioritized, perhaps even above the ones that we have prioritized to date, we would like you to put that in a sticky note that is a teal color. You will have group facilitators to work with you in this process. And so you can come off mute at that point and ask questions and discuss. We're going to go ahead and move into our groups now. So to do this, you should see that there is an option at the bottom of your screen, and it's going to look different on different screens for breakout groups. You may need to touch the button that